信心百倍的打好这一场阻击战、总体战，打好这一场人民战争。
The enemy was a new type of virus that had never been encountered before.
反复在烧，
发热、发烧
39度8，全身胀痛的关节疼痛。
因为这个病起病很隐匿，病人根本就不知道他自己得这个病。
It's a life or death battle, a race against time.
你只有往前冲，没有后退的余地。
我们是从12月底到现在没有一天休息的。
They look like ordinary people dressed in white coats. In reality, they are soldiers.
不怕是不可能的，人之常情。他们一累了，忘记了爬。
几十万的标本要采集啊，每一个标本都是护士面对被感染的这样一个风险。
Confront the challenge, stand strong, never retreat.
不能退了，如果我们都退了，还能怎么退？
我们要保卫我们的武汉，保卫武汉人民。
但是要尊重它，就是一个没有像战场，病毒来暗算，你看不见它，但是你感觉到它。
The initial battle proved to be a brutal encounter. On January the 22nd, more than 1,700 patients crowded into the 5th hospital in Wuhan, more than on any single day since it opened 97 years ago. The previous day, the hospital had been designated as one of the first in the city to treat patients suffering from fever.
是我上班20几年来见过的医院的春运。我们的医生就是坐在那里，就是不停地看，不停地看，头都抬不起来。
On December the 31st, the Wuhan Health Commission had reported 27 confirmed cases of viral pneumonia in the city. 1 month later, the number had multiplied 400 times, with cases spread across China, although most were concentrated in Wuhan.
病人增长很快的这个情况下，当时是非常的忧郁的，因为就是不知道当时这个病人这个情况我们到底能不能控制。
Wuhan Pulmonary Hospital was one of the first 2 hospitals in Wuhan to receive the new coronavirus patients. Hu Ming, its director of intensive care medicine, was in overall charge of their treatment. At the time, the term COVID-19 had yet to be coined, and there was no existing expertise for treating the mysterious illness.
SARS 或者是禽流感的时候，很快就知道我这个病人必须气管插管了，必须上呼吸机了，不做啊会死亡率多少？但是这个谁都不知道。
Hu Ming had gained considerable experience in treating patients during the SARS and H7N9 epidemics. This time, however, he was working in the dark and had no way of knowing how patients would respond.
焦虑，那肯定有点焦虑。这是一个新的病毒，它不管是从它的发病机理，到它对人体损伤的程度的疾病病程的变化的过程，最终的病理结果，对人最终的影响，这些东西现在还是未知的。
The virus was spreading. With more and more people falling victim, the medical workers had to employ all their knowledge and experience in fighting it.
都没有了，颈动脉搏动已经没有了。再推一支，再来一支，先向前走，过1分钟推一支。
they couldn't win every time. A patient, having survived several resuscitation attempts, might still succumb. To make matters worse, more and more doctors and nurses were being infected.
你影响加重了，是影响加重还是症状加重了？症状呢？还在烧着了。好。
As one of the first doctors to treat COVID-19, Hu Ming was often contacted by other doctors seeking his advice. Although he had dealt with life and death situations before, this time he was driven to tears.
大家都在同一个战壕里面战斗啊！你突然一下他说不行了，显然情绪上一下很难的接受。
He was crying for a coworker who had contracted COVID-19. Such fighters are not easily driven to tears, but this time the situation proved too much. In the early days of the battle against COVID-19, death was commonplace. More than 3,000 local medical workers in Wuhan and Hubei contracted the disease. Many of them wouldn't survive.
他太忙了，他女儿有时候找他，你知道都是在哪找他吗？都是去门诊找他。
他跟我说了，他还想着能够上一线的。
我还跟他约定了，我说我们到时候生你了，我们还要参加他的婚礼。
The deaths of these ordinary heroes was mourned around the world. Lives were being lost, but the fight went on.
当我得知我年迈的外公也在前线时，眼眶早已通红。 还有我的妈妈。
I'm lending you my mom. This is what Chen Qifang wrote in a touching open letter to COVID-19 patients, encouraging them to overcome the disease and cheering on the army of doctors, including her grandfather and mother. Dr. Liu Fan, Chen's mother, is a pediatrician who specializes in treating respiratory and immune diseases among children. She volunteered to treat COVID-19 patients.
所有的孩子就是自己的孩子，这个国家、这个社会是我们大家的集体的，去维护它，这是我们的职责。
Qifang's mother didn't come home for days on end. They could only say hello to each other via a video call. Sometimes, Qifang would wait for a whole day for her mother to reply.
我知道的，我衣服会穿好的。
Dr. Liu Dunli, Qifang's grandfather, is 73 years old and retired. He volunteered to return to work at Changjiang Hospital.
如果我不参加这一次斗争，那我这个医生的这几十年的生涯就会留下遗憾。这是一种使命感，一种责任感。是医生，没有哪个往后退缩。
The medical workers, as they bravely fought the dangerous unknown coronavirus, made countless personal sacrifices. Dr. Zhang Jian and her husband are both doctors. In a letter to Wuhan University's Renmin Hospital where she works, Dr. Zhang wrote, "I am applying to be posted to the observation room so I can better screen patients." She went on, "I haven't told my husband yet. I don't need to consult him because everywhere is a battlefield."
你必须要有一个很有经验的医生，你才能够真正的让流管室发挥作用。危险就在于很多都是有传染性的。
The doctors and nurses knew the risks they would be facing, but still they came to Wuhan from all over the country. 86-year-old Dr. Dong Zongqi examined patients from his wheelchair.
你说一辈子我为个啥？我不就几个病人吗？
Some doctors and nurses showed exceptional courage by returning to work after recovering from COVID-19.
本身就有一腔热血，这个时候就你应该在前面。
就是不杀，不辞艰辛，不辞艰辛。
On the COVID-19 battlefield, the soldiers revealed obvious signs of their dedication. The wounds covering their hands were caused by long hours of wearing rubber gloves and applying hand sanitizer many times a day.
有点疼，也很痒，有时候总是想挠，但是不能一挠，有时候就是皮破得更厉害了。
In order to preserve their precious protective suits, the doctors and nurses routinely wore diapers during their shifts. They applied Band-Aids to their faces to cover the wounds caused by wearing face masks.
待个20-30分钟，你们就会觉得各种胸闷不适。但是我的护士，她至少是5-6个小时，有的时候最长的时候，她会待10到12个小时。
不能上厕所，不能吃东西，不能喝水。我们做了一个医务工作者所能做的一切。
It was a brutal war, with ammunition in short supply right from the start. It was a struggle between life and death, which allowed no retreat. President Xi Jinping kept a close eye on the constantly changing developments in the epidemic situation. On January the 25th, at a meeting of the Politburo Standing Committee, he addressed the issues of manpower and supply shortages. He said that more medical staff should be dispatched urgently to where they were needed most. On February the 3rd, he reiterated the point, saying, "Resources for treatment, prevention, and protection must be sent to the front line in the battle against the epidemic, and priority should be given to meeting the needs of the medical staff and patients."
只有你们不倒下，我们才会有更多的病人从你们手中站起来。
Assistance poured in from all over the country. In less than a month, 330 medical teams comprising 42,000 medical professionals arrived in Hubei and Wuhan. Key resources, including medical masks, protective suits, test kits, and ventilators, were all produced at record speed and were immediately being delivered to Wuhan. It was a battle against the odds that brooked no delay. In response to the crisis, support came from all over the country.
举全国之力支援武汉，打好武汉保卫战，应该说呢是我们工作的重中之重。
其实对任何一个城市而言，我们出现了这么大的疫情，我们自己的卫生的资源、医疗的资源都是没有办法应对这么多的病人。
And so, teams of medical professionals began descending on Wuhan. Among them, 19,000 were specialists in intensive care medicine. They joined the front line in the battle, working alongside the local doctors and nurses. The arrival of some of the nation's leading medical professionals, numbering 2,300 doctors and nurses from all over the country, meant that the Guanggu campus of Wuhan's Tongji Hospital could start accepting more seriously ill patients.
交通车，一车子一车的，一来300-400个病人同时住院。
3天收满，3天3夜我们没睡觉，因为病人不能等，病人着急啊，放在外面就多一份感染的机会。
上上下下的感觉就是打仗，没什么话好说的。当时就觉得，就是觉得要冲上去了，炮火的连天的声音，就给人感觉你赶紧上去。我就坐这个角落里去写流程，写好以后，同级别的护长他马上变成那个文档什么东西到处贴，因为你这时候要完全培训大家掌握好不现实。不现怎么办？在这堵墙这个角落做什么事，我把它贴出来，做2步。这里是手消毒，第2步脱手套，再走过去。这个地方你要做什么事，不然的话你永远记不住。
然后在第一层帽子，每个篮子里面的东西都有，按照这个步骤来。
胖，我给2头克米做。
血包分先给个40到50的，把鸡装进水。
The emergency intubation team became known as the Expendables. Intubation requires opening up a patient's airway. The process exposes the medical staff to the most direct contact with the deadly coronavirus. Critically ill patients often suffered from respiratory failure and hypoxemia, resulting in dangerously low blood oxygen levels. They needed a tracheal intubation to stay alive.
我们要求是0失败、0失误。
After undergoing an intubation, this patient's blood oxygen level rose to 96%. 3 days later, however, it dropped to a dangerously low 93%. Even being given pure oxygen failed to remedy the situation.
这说明肺的底子太差，它里边肺可能这个肺泡里头啊，都是有一种胶冻啊或者水样的东西啊，这个呼吸窘迫的这个炎症渗出很厉害。
In the most critical cases, sudden multiple organ failure was a constant threat.
我打电话了，微信我都不敢接，我都发，我一怕听的说他有什么不好。
Did the lack of any effective treatment for this new killer virus mean there would inevitably be more deaths? Experts in multiple medical fields work together to buy precious time for those affected.
我活动成了护心队、插管队、这个护肾队、这个护肝队、营养支持、这个神经精神方面的支持、中医、中药。这个医生来讲，最重要的救命。
现在大家公认的，就是炎症风暴是重症向危重症转化和进展的一个很重要的一个原因之一。
Doctors describe a cytokine storm, which is characterized by a range of symptoms as a powerful signal that the human body is pleading for help. In treating it, a severe immune reaction is initiated to fight the virus. However, the treatment can itself cause multiple organ failure.
我们在前期的治疗这些疾病中，我们发现血液净化可以有效地清除体内的细胞因子，阻断我们的炎症风暴。
The doctors caring for the critically ill Mr. Chung started a blood purifying treatment. He was also connected to an ECMO machine to provide essential life support.
按照我们的指示来，深吸气，深呼气，深吸气，深呼气，知道吗？
The intervention proved timely, and Mr. Chung's vital signs gradually steadied. The feared cytokine storm did not occur, and after a few days, the doctors removed him from the life support.
把 ECMO 脱掉，你就解放了，你就好了。千万坚持一下，5分钟之内结束，好不好？ 看一看，看到了没有？你活过来了，活过来了，看到了吗？
Mr. Chung's lungs had started to work again, but the doctors still faced a race against time to halt the spread of COVID-19. The arrival of more medical staff and supplies and further exploration of new treatment approaches made it possible for many critically ill patients like Mr. Chung to recover. In the survivors, the immune system, given the opportunity to respond properly, helped to defeat the virus, increase the recovery rate, and lower the mortality rate. These aims were achieved through an intense battle against COVID-19.
眼睛从那么昏暗24个小时没闭过，我一怕眼睛一闭后人过去了，总想到自己有个家，想到儿子姑娘，总想睁着眼睛。
比如生命其实有时候是很脆弱，但有时候呢也是很坚韧的。对这个新冠肺炎病毒，它的认识我们也是逐步加深，艰难的迈出了第一步，未来可期，病亡率一定可以逐步降下来的。
Late January and early February was the most punishing time in China's war on COVID-19, when the number of new cases in Hubei and Wuhan saw a rapid surge. Sorrow and grief swept Wuhan as people said goodbye to loved ones. A 90-year-old grandmother, a Mrs. Xu, expressed her anguish in a letter to her 64-year-old son. "My dear boy," she wrote, "please hold on and be strong. You'll defeat this disease." By now, every hospital bed in Wuhan was occupied. For 4 days and nights, Grandma Xu watched over her son.
我常规的问他，我就说您有哪些不舒服，有没有发烧，有没有咳嗽之类的。然后他说他并没有发烧咳嗽，他是陪着他是儿子过来看病，他毅然决然的选择他自己一个人来承担照顾他儿子这个责任。他说我已经这个年纪了，我已经无所畏惧了。
On the afternoon of February the 4th, her son was admitted to the ICU. Now she could do nothing to help him. So she borrowed a pen from a nurse and wrote a brief but heartwarming letter of encouragement to her son on a page of his test report. Tragically, the old lady's son passed away later that afternoon. The doctors were distraught, and the grief-stricken family members couldn't bear to tell the 90-year-old the sad news until much later. At the height of the pandemic, patients had to wait almost 10 days on average to be admitted to hospital. Due to the treatment delays, many people with mild symptoms became seriously ill. Clearly, the capacity of the hospitals had to be increased as a matter of the utmost urgency. Wuhan has some of the finest medical facilities in China. However, the city's intensive care units were equipped with fewer than 1,000 beds. Although efforts were made to increase capacity, they fell far short of what was needed. With the number of confirmed COVID-19 cases surging as the virus spread rapidly, people wondered how countless more deaths could be avoided. Wuhan resident Li Lina has become known online as the gong-ringing girl. At the end of January, she and her mother both contracted the coronavirus. She issued a desperate cry for help in the hope of finding a hospital bed.
我当时就是不知道谁能来救我， 也不知道谁会听到这个声音，也不知道后续会怎么样，但是我真的是很无助。
Though she didn't know it then, a month later, her unique way of pleading for help would become associated with the policy of science-based targeted measures for preventing and controlling the epidemic. By this time, the construction, conversion, and expansion of Wuhan's existing medical facilities were underway around the clock. Every possible avenue was being explored for increasing hospital capacities. In fighting the war against COVID-19, the celebrated China Speed was being deployed. In less than 2 weeks, Huoshanshan and Leishanshan hospitals were built. Jinyingtan Hospital increased its intensive care units from 1 to 5. And at Tongji Hospital, people worked day and night for 48 hours straight to build new wards to accommodate additional hospital beds.
把原来的就连夜改造，连夜2个晚上，把110平米的房子改到了5000多平米。
Despite the increasing supply of beds, the city was still struggling to meet the surge in demand for hospital care.
我们日常是2000嘛，22号就到了5900，最高的一天是15700，没完没了的接，我觉得没问题。可是问题是还有那么多我没有接起来的，那才是最大的问题。
If infected people couldn't be admitted to hospital quickly, they couldn't receive the urgent medical treatment they needed. This, in turn, meant the risk remained that the epidemic could spiral out of control. In view of the battlefield situation, President Xi Jinping instructed that hospitalization and treatment must be provided to all those in need. The goal was to control the source of the infection and prevent the spread of the virus. In this beautiful city on the Yangtze River, millions of people were facing increasing hardship.
我是1月18号发烧，然后我爸爸是在1月25号，就是初一的时候也开始发热发烧，凌晨3点钟排队，晚上凌晨12点回家，因为这边的5医院、7医院根本都不收，因为它也是爆满的模式，已经爆满了。
So Liu and his family went into home quarantine and treated themselves.
最后什么时候进去？
方舱医院收的我。
什么时候？
2月6号。
The temporary treatment centers brought renewed hope to the suffering city. Liu Meng and his father spent several days in one, undergoing treatment and recovering before finally being discharged. In a 35-day period, more than 12,000 COVID-19 patients with mild symptoms were treated in these purpose-built facilities.
很难，而且这是过年，这不是你国家用钱都可以买到的。这个时候是需要强大的国家凝聚力来调动资源，这才能办到。
你看我们今天是不是又是豪华晚餐呢？
During the war against COVID-19, several key battles were decisive in securing overall victory.
大批的患者没有能够及时的收入到医院来，会造成更进一步的家庭和社区的感染。这个呢是加剧疫情的最重要的因素。我们必须想办法解决收治容量的问题。
The temporary treatment centers were specially designed mobile medical facilities of a type first used in the wake of the Wenchuan earthquake in 2008. The unit was represented in the military parade celebrating the 70th anniversary of New China. However, they had to be converted to accommodate more beds. On February the 3rd, construction of the first 3 temporary treatment centers got underway. By the evening of February the 5th, the first patients were being moved in.
非至善之法，但是没有比它更善的办法的时候，是解决收治的这样一个主要矛盾的现实之策。
February the 12th would prove to mark the peak of the epidemic, with almost 13,500 new COVID-19 cases recorded in Wuhan. 92% of them were first-time suspected cases identified by imaging testing, a technique that, by speeding up the diagnosis, allowed the patient to be quarantined much earlier. There was no time for delay in building the temporary treatment centers and providing the desperately needed additional hospital capacity. 30 specialist facilities were hastily built, and 16 were put into immediate operation, providing an additional 30,000 new beds. The number of hospitals treating COVID-19 patients increased from 2 to 86. The situation had been transformed, from patients waiting for beds to beds waiting for patients. Ms. Zhao, the mother of the now famous gong-ringing girl, was checked into Wuhan's Hanyang Hospital, which had an inpatient department specially equipped to handle COVID-19 patients. Her daughter, Li Lina, whose symptoms were mild, was admitted to a temporary treatment center. The experience of the mother and daughter and other patients reflected the transformation that had taken place since the adoption of President Xi Jinping's instruction that all those in need are hospitalized and treated. Amid the ongoing battle, President Xi emphasized 2 key issues. These were ensuring community-based epidemic prevention and control and guaranteeing that patients received treatment. Gradually, a 3-tier system was established in Wuhan. Seriously and critically ill patients were admitted to designated hospitals. Those with mild symptoms were checked into temporary treatment centers. Communities assumed responsibility for screening fever patients who might be carriers and for assessing anyone who had come into close contact with confirmed or suspected cases.
尽快的让他们进入我们的医疗救治系统，防止病情迁延恶化。 切断它传播他人的途径，叫应收尽收，它的价值就在这。
Experts from the World Health Organization have praised China for its leadership, organization, mass mobilization, and actions during the COVID-19 crisis. They have stated that the country set an example for the rest of the world to follow in epidemic prevention and control.
Before this outbreak began, Hubei had 137 isolation beds. Today there's over 14,000 isolation beds. You tell me any other country in the world that could achieve that.
For the first time, the term pathological changes was included in the text. On the evening of February the 13th, the family of a COVID-19 patient who had passed away at Jinyintan Hospital agreed to donate his body for medical research.
我们对他鞠躬时间特别长，非常感谢这些人，他们实际上我就是大爱的，也是为了我们人类的健康付出的这些东西。
So, the first ever autopsy could be carried out on someone who died of COVID-19. It started at 1:30 a.m. on February the 16th and lasted for almost 3 hours. It would provide vital insights into the mysterious killer coronavirus.
会反映出个什么东西呢？它又在深部的气道里面出现粘液成分。这种成分的话，如果我们在治疗上不去针对性的做处理的话，你可能起到反作用。应该去把这个粘稠的成分把它化掉，让它溶解掉。
Further autopsies revealed that COVID-19 impacted not only the lungs, but also multiple other organs, including the heart, spleen, liver, and kidneys. This discovery helped to shed light on the blind spots in treating the disease. doctors could now prescribe the right medicine to target specific issues. In the 47 days from January the 16th to March the 3rd, the National Health Commission released 7 versions of its diagnosis and treatment protocol for COVID-19. The document underwent regular updates as a deeper and better understanding of the coronavirus emerged. New drugs, new treatments, and new results and findings were added.
哪位指挥？来吧，一起来做个俯卧位。然后亚军，我喊1、2、3，往这边平移20厘米。来，1、2、3。
The prone position exercises developed by Chiu Haibo help to ease respiratory distress. They were first recommended in the 5th version of the diagnosis and treatment protocol.
在这个疾病的快速流行、快速爆发的时候，我们形成一点经验，马上放到诊疗规范里。实际上，这是可能历史上前所未有的。
策略上要转变，那就是实际上你积极救治。
对对对。
就是关口前移，说通俗一点就是往前赶。
In the war against COVID-19, collective experience and skills form the basis of the successful China approach. Experts who had worked on the front line during the SARS, H1N1, and H7N9 emergencies again stepped forward. While working in hospitals to treat patients in person, they also provided guidance at the national level.
像在前方钟南山院士团队，另外我们还有3个中医的院士和国医大师团队。所以这次呢，一方面呢派出的力量强另外呢我们中西医的结合也是非常密切，发挥各自的优势。
Veteran medical expert Dr. Jiangbo Li played a pivotal role in advocating prevention and treatment measures that combined the best of Chinese traditional medicine and Western medicine. However, after working for 20 days without a break, Dr. Jiang needed surgery on an inflamed gallbladder. Yet, within 3 days, he was writing treatment plans for his patients. He said that, having left his gallbladder in Wuhan, he would stand by the city through thick and thin.
应该发扬这个中西并重，然后呢，中西结合，共同治疗疾病。但是用中药一定要用早。
该给你发药了。
The use of traditional Chinese medicine was recommended in the 3rd edition of the NHC's Diagnosis and Treatment Protocol for COVID-19. The advice was updated in each subsequent version. TCM would eventually be adopted in treating 75% of COVID-19 patients. Most of those who recovered had received some form of traditional treatment. President Xi had stressed that scientific approaches and solutions would be vital if the war against the epidemic was to be won. In noting the need for coordinated action between the battle on the front line and the support in the rear, he described scientific research as a powerful weapon in the control and prevention of COVID-19. Chinese scientists had worked out the complete DNA sequencing of the new coronavirus by early January. Next, they separated the virus strains. This laid the foundations for the possible development of a vaccine. Researchers worked around the clock. On March the 16th, a team led by academician Chen Wei at an enterprise in Wuhan received approval for the first human trial of a COVID-19 vaccine.
国际的规范，按照国内的法规，已经做了它的安全、有效、质量可控。
The worst was over. From late February to mid-March, the number of new confirmed cases in Wuhan fell steadily. On March the 18th, it reached 0. Spring had come, bringing warmth to the city, but it was the doctors and nurses who had truly warmed people's hearts.
啊！不可以这么说的啊！过两天就都好了，你快接受不行的话，可以过两天可以出院了。一定要对自己有信心，知道吧？
我觉得病人，尤其是轻型的重症监护病房的患者，不舒适的症状、隔离的这样一个状态，接受这样一个治疗，真的很不容易。在给危重症患者治疗护理的过程当中，让他们不要以为自己是名患者。 想让给他们像正常人一样的一个生活的这样一个状态。
这块这么
我醒了以后，他们个个关心我，他说你的生命来的不容易啊，他们不是要我加油，我加油。
危难的时候，大家抱成团，成为一家人，其实大家都很不容易。
Those with love in their heart care about others. While Ms. Zhao, the mother of the gong-ringing girl, was in hospital, she got very upset when she found she hadn't received a package containing her denture cleanser. The nurses went everywhere trying to find it.
我母亲就在那里不断说啊，我的牙不洗，我有很多细菌，我会病得更重的。她就在那里很焦虑。那些护士给她把这个包裹找回来了。所以说，医生不光是治病，他还治疗他们的心理。
The doctors and nurses always tried to keep their patients calm and also to inspire and invigorate them.
人间大爱在方舱。
为什么你头上写个周黑鸭呀？
我想吃周黑鸭，他的头上写了热干面。
哦，你是热干面。
啊？
你是热干面，热干面。大叔，好一点了吧？很棒。我们可以去跳广场舞，活动活动，稍走一走吧。有我们在，大家就放心。有任何的事情，都来找我们，我们即刻帮你去解决。这是我能做的。谢谢大家，我们大家一起加油，早点回家。
Before being admitted to the temporary treatment centers, the patients had questions and doubts, but these were soon forgotten. Part of the treatment involved creating a relaxing, positive atmosphere. The words on the medical staff's clothing and the pictures on the walls encouraged them to be more optimistic. The Chinese people stood shoulder to shoulder in the fight against COVID-19.
我们爱你。
别再进来了，别再进来了。
哎，进来了，加油点，
早点出去，不要进来了。
早点出去。
就是阿姨今天出院，我真的为她很高兴。 他跟我说：“你们千里迢迢的过来，你们一定要保护好自己，你的家人还在等着你们。”我觉得不光是我们来武汉救济他们，他们也很时时刻在温暖着我们。我们来到这儿真的是让武汉人民暖到了。武汉最美的不是樱花，是武汉人感恩的心。
The gong-ringing girl and her mother both recovered and returned home. For them, getting together for an ordinary home-cooked dinner is the happiest of occasions.
我当时就是特别感动，就是能帮助我们的，不只是我们的朋友， 有很多我们甚至是不认识的人也在帮助我们，所以我们真的是非常的感恩。
With more patients getting better by the day, the city of Wuhan itself was also recovering. On April the 26th, no new COVID-19 patients were admitted to hospital in Wuhan. In the war against the epidemic, the cumulative cure rate had risen steadily. By the end of April, it reached 92%. The rising number of deaths had been terrifying in the early days, but after a steady decline, one day it became zero. The overall strategy had been to put people and life first. The finest medical workers had been sent to fight the war, supported by the whole country. The policy of science-based prevention and treatment and targeted measures had guided practice on the ground. The medical professionals had worked tirelessly. All these factors came together to achieve a relatively low death rate. The war against COVID-19 has been arduous and unprecedented. The battlefield extended across Wuhan, Hubei, and the whole of China. The country had been shaken to its core, but still it advanced bravely.
你们都穿着防护服啊，戴着口罩啊，我看不到你们的这个真实面貌。但是呢，你们在我心目中都是最可爱的人，所以我在这里啊，代表党中央，向你们啊，表示诚挚的慰问，致以崇高的敬意。
The bright light that had shone during the terrible war represented the burning desire of the people. The public health care system had triumphed, thanks to the contributions of millions of people.
I要尽早归队，我还有跟我一起战斗的兄弟姐妹们。
要坚强啊！你就到我们这来，家家外有做好戏的饭菜里啊！
生的渴望，死的敬畏，用我们的血肉之躯筑起一座生的城池。一定要相信有希望，要坚持。
When confronted with death, a soldier is not afraid. Heroes are those brave individuals among us who stand up to be counted. No one is born brave. Courage is ignited by a light in the heart. The white coat of the medics is the uniform of a soldier who is prepared to give his life to save the lives of others. The love and care in the hearts of these soldiers and their courage knows no bounds.